Traditionally, medicine in general and also psychiatry, they try to focus on deficits, so what's wrong in a patient, what doesn't function very well, what's missing. But there are also traditions to do the opposite and to identify and utilize what strengths are there. So, and most of our strengths are in skills and our relationships. And patients have a number of strengths and resources too. And trying to mobilize and utilize those strengths in communities and families and with healthcare professionals, that's what we call resource-oriented interventions.
Resources can include a strength and skills of all individuals. However, most of the resources for all of us can be found and mobilized in relationships. These relationships can be found, for example, in family, friends, colleagues, neighbors, other people in the community, or healthcare professionals.
Since 2017, a team of international researchers have been exploring how we can best maximize the existing personal and social resources in low and middle-income countries. In GLOBE, an NIHR-funded global health research group, we explored how 3 existing resources can be utilized to support mental health care. The resources were in relationships with healthcare professionals, with families, and with volunteers from the community.
The first 2 approaches we used in this research were firstly the Dialogue Plus intervention. With this intervention, the clinician provided a tablet to the patient, and the patient was encouraged to use the tablet in rating their satisfaction with life and with their treatments. They were also encouraged to identify what their top priority concerns were. And in that situation, the clinician helped the patient to identify solutions to their concerns. This was very useful for patients because they were empowered, first of all, to identify their top priority concerns, but also find solutions to those concerns. And the second one was we used a family group approach to supporting patients with mental illness. Each patient was allowed to identify a trusted family member or friends and come with those people to a family group meeting. In this family group, they discussed a number of issues. But what was most striking about this family group meeting is that patients exchanged life experiences with each other. And of course, also the family members or friends chipped in. And that meeting was also attended by a healthcare provider.
And finally, we look at volunteers in the community in a befriending program in which the volunteers were linked individually or in groups to their patients to provide them psychological, empathic, social, and practical support. One or more of these interventions, dialogue, multifamily intervention, and volunteers were tested in Argentina, Colombia, Peru, Pakistan, Uganda, and Bosnia. The results reflect that all of them are feasible and acceptable for all the patients and their families. We have reduction of mental health symptoms, we have improvement in quality of life, we reduce stigma, barriers, inequalities, and we get inclusion of those that suffer mental health problems.
I think there are a lot of benefits for working with arts-based organizations for well-being and mental health specifically. It actually makes sense to work with organizations that already exist in the community because they might be doing work for arts, sports, and other participatory approaches. And there is evidence to suggest that that kind of work does lead to improved health outcomes such as improved social emotional skills, improved social capital, as well as improvement to your quality of life. There's also evidence to show that community members find a way to express themselves more cohesively or in a new form that other talk therapies may not give them access to. So there's a lot of worth in working with participatory and arts-based approaches there.
I think these resource-oriented interventions are very useful for people with severe mental illness. They use available resources. They use patients as agents so that they participate in the decision-making, and they encourage them to become participants in their own community so that there's less stigma about it. It gives them confidence. And this, I think, is key in ensuring that actually their quality of life improves, and they take their medications willingly, and they use any available resources willingly. And this improves their symptom reduction, as well as ongoing quality of life.